All right. So before we begin our conversation today, we have a few housekeeping rules that we would like to go over and review together as a group. So I think we can go to the next slide. So today's session is available in English and Spanish. And so we need everyone to select a language. If you go to the bottom panel, you should see a globe icon and an interpretation service. So please, you must click the language, either English or Spanish. This is really, really helpful so that we can make sure that everyone gets this amazing information from our speakers today. The session also has closed captioning available. So if you want to click on the closed captioning icon, you can get a live transcript of what people are saying today. We request that you stay muted until prompted, and that you can be interactive and use our chat for comments, questions, or reactions. And you can also use the Zoom Q&A function to ask questions, which can also be found on the toolbar at the bottom of the screen. I'm now going to review our practice agreements and center in this space together. So I will start by reading them. Be present, be accountable. Feel no pressure to speak, yet resist the temptation to stay silent. Be brave, be inclusive. Our values, cultural identities, personal experiences matter. Recognize that conflict is always possible and conflict is okay. Take space, make space. Call attention to people's unheard voices, ensuring that all individuals have space to fully participate. Address racially biased systems and norms. Call out power dynamics. Recognize personal biases and consider how they might impact our actions. Avoid becoming defensive when Black, Brown, or Indigenous folks speak from lived and personal experience with racism. Now that we are ready, I am going to pass the conversation to Jennifer Olson, the CEO of Rosalind Carter Institute for Caregivers, and she will kick off the meeting. Thank you.
Thank you all for joining us today. I'm delighted to be with you to talk about a topic that I know is so important to family caregivers, which is finances. In our work at the Rosalind Carter Institute for Caregivers, we often find that the two F's are driving the most stress for families: funding or finances and family. So we'll talk about the easy one today, finance. I'm delighted to be with three panelists who are experts in their field. And before I turn it over to them to introduce themselves, I just wanted to share that our work at the Institute is focused on friends, family, and neighbors who care for someone ill, aging, or disabled. And our work is grounded in Mrs. Carter's infamous four kinds quote, recognizing that we all either are, were, will be, or need a caregiver at some point. So I hope as you listen today, you're thinking about both your current needs as well as future issues that may come into play for you. We recognize that we don't intend to make caregiving easy, but rather to make it less hard through systems and structures. And part of today's conversation, we'll look into some of that work. As we all recognize, today's caregiver is tomorrow's patient. During this session today, we'll talk about common barriers that caregivers face around financial issues, as well as some bright spots or areas for engagement that we think individuals, each of you on this call, can advocate for or engage in. We'll hear opportunities from three different, as I said, experts who have different views on the caregiver ecosystem, and I hope you find insights valuable to you throughout today's session. At this point, I'd like to turn it over to my esteemed panelists to introduce themselves and share a bit about their relationship with caregiving. I'll start with Melissa.
I'm Melissa Johnson. I'm the program manager at the Military and Veteran Caregiver Network at American Red Cross. I appreciate the opportunity to be here for this important conversation during National Military Appreciation Month and the month of the military caregiver. I've been a caregiver to my husband for 18 years. He was injured in Iraq in 2006 and has a traumatic brain injury, post-traumatic stress disorder. He's legally blind and has a host of other chronic physical and mental health issues. After his injury, he medically retired from his position as a lieutenant at the fire department. He was in the Army Reserve, so he had a civilian job in addition to his military role. And then he was medically retired from the Army. I was an elementary school teacher at that time, and I needed to take many days off to travel for his medical care. Often 1 to 2 days a week we were gone. I eventually took a leave of absence and ultimately resigned my position in 2010 as he needed more assistance and supervision at home. This resulted in loss of income, lack of health insurance, and my contributions to retirement, Social Security, and Medicare stopped. I'm fortunate now to be able to work from home and have a flexible work schedule and understanding coworkers. And this allows me to meet the demands of caregiving without sacrificing my financial situation. So I'm excited to share today some of the things we've experienced.
Wonderful to have you. Tony?
Hi, everyone. My name is Tony Gingerelli. I serve as the Director of Policy and Advocacy for the National Alliance for Caregiving. We build partnerships in research, advocacy, and innovation to make life better for family caregivers, and we're really focused on systems change. So I'm really excited to be with you here all today for this conversation, particularly because May is Older Americans Month, and I'm happy to share a little bit about my personal experience as well as my work at NAC. I come to this space as a family caregiver and also watching my mom serve as a family caregiver to my grandmother. My mom balanced 2 jobs while also caring for my grandmother full time. She would thankfully had a flexible workplace where she could come in between her lunch break, as well as in between 2 jobs to come support my grandmother. And there was one point where my grandmother fell, and thankfully we had a family friend next door who was able to come and check on her at that time. But it was at that point that we realized that there was my grandmother was no longer able to stay at home with us and would need to move to an assisted living. So something that's really important for me is that ability and choice to age at home. So that's where I come to the space. And I saw the financial impact that it had on my mom as she balanced those 2 jobs and her health. So I'm happy to be here today to have that conversation about how we can change our systems to better support family caregivers and their financial sustainability.
Thank you, Tony, and thank you for sharing both your personal and professional ties to this work. I'll turn to you, Tricia.
Hello, everyone. I'm happy to be here today to share some perspectives and hear what you all have to say. My name is Tricia Brisbine, and I'm an independent consultant working in family advocacy. I currently work on a couple different projects at Gillette Children's Specialty Hospitals and Clinic, and I am also the Title V Family Delegate in Minnesota. I came into this from a few different perspectives. So I grew up watching my mom care for my dad who had muscular dystrophy. And as they both started to age, more and more of the caregiving responsibility did fall upon me as I was an only child. Then I ended up caring for my dad's sister who also had muscular dystrophy. And that was another aspect of caregiving where I moved in with her to help. Then I had my son 14 years ago, Charlie, who was born with some complex medical needs and different healthcare needs. And I was a single mom, and I found it very difficult this role as the caregiver, as the mom was very difficult for a lot of different reasons. And I think we'll get into more of that later, but Charlie's 14 and he has global developmental delays, ADHD, scoliosis, bilateral hip dysplasia, and a whole host of other diagnoses. I'm very thankful to be here today, and thank you for having me.
Well, Tricia, I'm going to turn it right back to you. Given all of the experiences you've had, you've probably seen the ways policy can be either a help or a hindrance when it comes to financial sustainability. Can you share some of those experiences you've had?
Sure. So like I said, I was a single mom. In my 30s, I had I had a mortgage, a cute little house, a cushy consulting position with the state, and gave birth to my son and just assumed that I'd be able to take him to daycare. And that was not an option because typical daycares don't want sick babies or babies who may be sick or babies that they don't understand any medical needs or may need extra. So, despite finishing my master's degree and having a lot of things in place, it was very difficult for me to find a job or work a job because I just didn't have access to care for my child. I did not have family around to help. Um, and finances were limited without being able to work. So I went from being, pretty independent and self-sufficient to really having to rely on a lot of public government systems to help me navigate and just survive. Is we needed a lot of support to navigate all of these complex systems of care. And one of the things that I think, would be helpful in the idea about childcare would be that inclusive daycares, childcares, not a separate childcare for a sick child or a child with extra needs, but making our current daycares a little more inclusive, and policies on that could be really helpful. I think that it would be great if employers could have a better understanding of the importance of family medical leave and how much that could really benefit them, not just their employee, but also benefit their organization or their business. Personal care assistance, that is something that we're able to access at times in different areas. And right now we're experiencing a huge workforce shortage where these individuals are hard to come by. It's difficult to find funding to pay them what they're worth. And we need some quality PCAs. That would be really great. And then another solution that I think, as we look at policies and how they could help, is it'd be really great if we could get some help with coordinating care. These systems are all very complex, convoluted, and siloed, and a lot of times we need a hand. It's a full-time job separate from caring for our loved one, just to manage the appointment calendar and therapies and things like that.
Well, Tricia, thank you for walking us from the challenges into potential solutions. I'm going to turn it to Tony. The team at NAC has done so much work to understand these financial impacts and look at policy opportunities. So Tony, can you share some of what you're seeing?
Yeah, thanks so much, Jennifer. So we know from the data that our current systems and policies are not supporting family caregivers in the way that they can be and should be. Every 5 years, the National Alliance for Caregiving and AARP publish a report called Caregiving in the U.S. based on a national survey. And our most recent survey found that 6 in 10 family caregivers are also working full-time or part-time in addition to their caregiving responsibilities. And most working caregivers, about 61%, still report having no paid leave at their workplace, which is truly concerning. Additionally, we know that about 45% of caregivers have had at least one financial impact as a result of their caregiving responsibilities. And family caregiver savings are diminishing. 22% of family caregivers, according to our survey, say that they've used up personal short-term savings, and 12% have said that they've used up long-term savings. So that includes for things like retirement and education. We also know that nearly 2 in 10 have left bills unpaid or paid them late, while another 15% have reported borrowing money from their family or friends. And additionally, 1 in 10 have been unable to afford basic expenses like food. So, I share these statistics. One, I think a lot of times people feel very alone when they're going through these financial struggles. So one, knowing you're not alone, but two, I wanted to emphasize that it doesn't have to be this way. We can have an infrastructure that supports family caregivers. And I'm really excited as we continue on in this panel to talk a little bit later about what some of those policies could look like, and envision a world where family caregivers are supported.
Thank you, Tony. Melissa, I'm going to turn it to you. You referenced an 18-year mark. And so I would say that means you're thinking about long-term care and long-term care financing probably every day. So love to hear from you about the lack of long-term care financing and how you see that impacting families.
Yeah, the 18-year mark was big for me. I remember reflecting, it was just last month that, that's the equivalent of raising a child to adult. We've been in this a very, very long time, and a lot of things have changed. And, we're at a point where I was out of the workforce for a period. We were, both had low income civilian jobs. I was a teacher, he was a firefighter. So we weren't putting a lot of money into our retirement plans that we had at those jobs. And now I'm looking at, being 53 years old and needing to start making sure that we're secured and concerned about, what kinds of things are going to be coming. Will there be enough Social Security or Medicare? Will we qualify for, certain benefits like that? It is concerning for me, but I also, think about the caregivers that I serve. There are people who might be caregiving for a loved one. For example, when I took care of my dad when he was on hospice care, the caregiver in that case and the care recipient aren't sharing a household income. Whereas my husband and I share an income. If you are caring for an adult child, or you are a sibling, or you are a child caring for your aging parents, that individual might not be contributing to your income. And that makes it even more difficult if you can't be in the workforce, if you need to sustain your own household. So we look into things like respite care and home health programs, and we do have opportunities through the VA and through other nonprofit organizations, but there are lots of people who don't qualify for those programs, or the programs aren't available in their area. I'm in a rural area in South Dakota, but we have a lot of extremely rural areas across my state where there aren't any home health workers that are within a 3-hour radius of you that are going to come into your house and assist. And so it really puts the caregiver in the position of choosing between working and caregiving, which is what I experienced when, my husband's doctor and my doctor both said, have you thought about resigning and being home to take care of him and to take care of yourself? We also are concerned right now about what happens when something happens to me. My children, I have 3 adult children who have children of their own, but they're going to need to step in and help their father. And so how does that impact their income? None of them live in the same city. Does someone have to move in there? Do they have to move here? What kinds of things would they have to do? And that really concerns me. Like, what am I leaving behind for the next generation? Another big concern for caregivers is life insurance. When a veteran leaves active duty, they have 120 days to convert their service member insurance to VA insurance. And a lot of them aren't aware of that. And what happens is, because of their health issues and their disabilities, they don't often qualify for other life insurance. So there's a lot of families out there who don't have any type of safety net if something happens to the veteran. There are death benefits for survivors. However, those are usually a fraction of what the veteran is earning through their own, while they're alive, getting their disability benefits. So it's really, really crucial for caregivers to stop and look at how to prepare for your financial future. What are you going to need to live on? And how are you going to take those steps, rather than waiting until we are at retirement age before we think about those things? And one last thing I want to mention is, we are fortunate within the VA healthcare system that there are nursing homes available for veterans. However, it's not a solution for everyone for long-term care. The veteran has to be enrolled in the VA system. They must need nursing home care for their service-connected disabilities, and they have to have a 70% or greater rating. The veterans' homes are not always located near where the veteran lives. In our state, the veteran's home is 6 hours from here. So if my husband goes into the nursing home, do I need to move so that I can be nearby, so that I can advocate for his care, so I can spend time with him? Do I need to travel 6 hours back and forth every couple of weeks? What is that going to look like? And what kind of financial burden does that put on us to make those types of decisions as well?
Well, you've brought many questions, and I hope some on the call have heard some of those important timelines that you shared also for their future planning. It's one of those things you don't know until you know in this space. And I'm sure, Tricia, thinking about long-term financial impacts is something that you have been grappling with in your many caregiver roles.
Absolutely. And one of the things that crosses my mind is how complicated it is and how hard it is to navigate all of these systems. Um, I am, I have a higher level of education. English is my first language. Um, I no longer have the financial concerns. We're fairly stable. I consider myself emotionally stable most days. I have a lot of privilege. And despite all of that privilege, it is still very difficult to, figure out what's out there, what could be helpful, how to make it work for you, coordinate all the things. So I think about that for people who may not have English as a first language. That just adds another layer. And, we have a lot of rural areas of our state or outstate areas that we would consider in Minnesota. When people have to travel 4 hours to get specialty care, and coordinate that, who can work a job and have to take off 2 full days just for 2 appointments or 1 appointment? So I think that there's a lot of health equity that we need to be considering intentionally, and how to make that more accessible. And when we think about the cost of care, sure, it's probably the most affordable for the larger systems to, count on an unpaid family caregiver to remain in the home as long as possible. But we need to think about too, what the cost is then when something happens to that unpaid caregiver or other systems have to take over. And what happens a lot of times is if there's no one, if you don't have a deep bench, we're forced to, and I'm going to use the word institutionalize, when we can no longer care for our loved ones and put them into a very, in an environment that is not home-like at all. And it is certainly not a place of a living situation of their choice.
Definitely not in most cases. Tony, I'm going to turn it to you, and I'd like us to talk a bit about what opportunities or options exist for people for whom Medicaid is not an option to cover a lot of these long-term care costs.
Yeah, that's a really great question, Jennifer. And the honest answer is that there are really limited opportunities for those that are not eligible for Medicaid. And I think this question emphasizes two really important things. One, why it's so important that we protect existing Medicaid funding. And two, why we need to work to expand and create new policies to support, to financially support family caregivers who don't qualify for Medicaid. Because often, those who can afford additional long-term care support are okay, right? Still struggling, but are okay. But it's really those from lower middle and middle income backgrounds that are kind of left out to dry. And there are some additional long-term supports for veteran caregivers, which I know Melissa is going to talk a little bit about. And also on the Medicare side, Medicare recipients may be eligible for part-time skilled care if they are homebound and meet specific criteria. And if you qualify for home health services, Medicare Part A benefits include medically necessary part-time or periodic skilled care delivered by, for example, a nurse, but those are only in some circumstances, right? So again, the options are limited, and it's part of the reason that I'm so happy we're having this conversation about what needs to change to make sure all family caregivers and those they cared for are supported.
Melissa, can you share some of what you know about the veteran and military space for those who don't qualify for Medicaid?
Yeah, absolutely. So, I mean, in the veteran and military space, we are fortunate that we do have systems like the Department of Defense, the Department of Veterans Affairs. Some of us are eligible for TRICARE, which is the military's insurance. And that does cover, a lot of costs, and that's very fortunate for us. What happens in those systems is the caregiver basically becomes a care coordinator. We're navigating these complex systems of care and benefits where even the employees and providers might not know what assistance is available. The programs might be different from area to area. It can be difficult to find the forms. It can be time consuming. And we end up being like medical records professionals reading through the medical records to make sure that the information is in there that we need to qualify for the benefits, and making sure that we know what forms to use and where to submit them. An interesting component of that is that veterans' pay and benefits through these systems are based on multiple qualifying factors, including like their years of service, their rank, the era or location of service, their percent of disability. So not everyone receives the same level of benefits. And oftentimes, if the rating isn't a high enough rating, they may not qualify for something that they should qualify for. And so that can be another barrier to getting those services. TRICARE is military health insurance. Certain individuals that have served over 20 years and qualify for that for life. If they're disabled, they might get it when they're younger. If they're not disabled, they can start that at retirement. There's also CHAMP VA, which is through insurance through the VA for some families who qualify. But these two insurance programs are not accepted everywhere. They don't pay very well. Specialists are often not included in these. They don't accept the insurance. There are expensive tests and procedures that aren't covered. Where I am, it's very limited because we don't have as many providers. They don't want to take TRICARE, so we end up traveling a great distance. Premiums might not be affordable, and mental health services for family members aren't often covered. The distance to VA facilities can be a barrier. We are 3 hours away from the VA hospital. They do offer a care in the community program, which will allow the veteran to go someplace closer to home if the VA is too far. But because of where we live, it's often that the provider we need to see is also 3 hours away. So we still have to travel, even though we're using the care in the community. Not all civilian providers contract with VA, so we can't always get someone in our hometown. There are issues with medications being covered. VA and DoD have non-formulary medications. So if a civilian provider through care in the community recommends something, it may not be covered by the VA or DoD, and we end up paying out of pocket for those. I do have TRICARE as my insurance, but they also have restrictions on certain medications, and they've greatly reduced the number of pharmacies that can accept TRICARE, preferring to use their own Express Scripts, which is their mail order pharmacy. So in the last few years, I've had multiple issues getting my medications. There's supply issues, and I end up going to my local pharmacy, and I pay up to $100 more for one prescription. So this is another area where as caregivers, we'll sacrifice our own health in favor of the family's finances, because if I have to pay $100 more for each of my prescriptions, or even, $10 or $20 sometimes is enough for me to say, I'm going to put it off this month. And so that is a big concern. Even though we have these safety nets and these programs designed for military and veteran families, they don't often meet the needs of what the family needs. So it's a blessing. I don't mean to run it down and say it's not a good thing, but we notice from the work I do, there's a lot of people that encounter barriers to these services.
Well, thank you for sharing those barriers. And also, I think for everyone listening in this conversation, we've heard a theme of how complicated all of the coordination is, all of the forms and all the processes. And so while we don't often describe it, there is a time tax that comes into play in a caregiver role. I'm going to take moderator's privilege here and speak a little bit about some work we do with employers, because we think that, as we've heard, so many caregivers are also trying to balance their employment. And there are things that employers can do to support and reduce some of these challenges. One would be to audit the benefits that they offer from a caregiver lens. If you're offering something for a newborn baby, are you also offering it for a caregiver of an older adult or an equivalent service? Have you made sure that benefits are broadly useful? Can your in-law receive some of those benefits, or how can you expand those definitions and those structures so that supports can be in place? when you are picking your health plan for the next year, how can you put into the request for proposals questions about what caregiver supports exist or how the insurance company handles claims? Because I could imagine that each of the people on this call can explain the challenges of dealing with advocating for some claim challenges, and think about those hours that an employer loses out because their employee is struggling with that. Or to look at all of the things that are happening outside of the doors of the employer, that while you could provide an amazing stipend, if there's no care worker, that stipend won't be useful. So what are the roles and opportunities that you have? But all of that is in place to ideally keep a caregiver working towards those retirement savings and those other elements going forward. We've heard a lot about the challenges, so I'm going to switch us to opportunities and excitement. What are you thinking about and most excited about when it comes to policies or legislative language that's on the table to support caregiver financial sustainability? Tony, I'm going to start with you.
Yeah, absolutely. I'm really happy that we're talking about solutions. So we know from our friends at AARP that caregivers spend on average over $7,200 a year out of their own income on their caregiving responsibilities. So one piece of legislation that I just wanted to make folks aware of is the Credit for Caring Act. And this is at the federal level has been introduced. And this bill, which is both bipartisan, so supported by, has co-sponsors that are both Republican and Democrat, as well as bicameral, so introduced in the House and the Senate, would allow eligible caregivers a tax credit of up to $5,000 for 30% of the cost of long-term care expenses that exceed $2,000 in a taxable year. So I think that's definitely a step in the right direction. The legislation again has been introduced. And last week, the governor of Nebraska just signed a caregiver tax credit into law, which was really exciting to see. So that's some movement there. And a lot of times we talk about things that are happening at the federal level, but that's just an example of things that are happening at the state level, and why state level advocacy is so important. We saw Michigan's governor also proposed a caregiver tax credit in their state budget. So that's one policy I wanted to bring up. The other is paid family leave. I know this is something that this was mentioned by both Melissa and Trisha as well. NAC is a part of the Paid Leave for All campaign, which is advocating for a national paid family leave policy. And under Paid Leave for All's leadership, one thing that we're very proud of their work is they've really emphasized the importance of creating an inclusive paid leave policy, right? That includes family caregivers, that includes medical leave. And that's, we're very proud that they're leading that conversation, and NAC has been a voice on that as well. A few states more should have paid leave policies. So would also emphasize, if your state doesn't have one, to be talking to your legislators about introducing legislation on that. And then the last piece of policy or legislation that I think could really have a significant impact is something that we heard time and time again so far through this discussion, is retirement, right? Caregivers are doing, I think I just froze for a minute. Caregivers are doing work, right? And that's something I like to emphasize over and over again, even if it's taking place in the home. Again, AARP had put out a report called Valuing the Invaluable, which estimated that unpaid work provided by family caregivers is valued at an estimated $600 billion annually. And that's a billion with a B. And despite this work that caregivers are doing, they're missing out on Social Security benefits, which impacts their retirement. And one policy that has been proposed is a Social Security tax credit. So there's a Social Security Caregiver Credit Act, which is a bill that would give caregivers who have left the workforce credits equal to about half of the average national wage. And the bill specifically credits individuals who provide at least 80 hours of care per month to dependent relatives without monetary compensation, with up to 5 years of deemed wages for purposes of determining their Social Security benefit amounts. So those are just 3 examples of policy that I'm excited about, that I think have potential to really impact the financial sustainability and security of caregivers in the U.S.
And Tricia, is there some policy that you're excited about?
Here I can really only speak to, what it looks like for us. And here in Minnesota, where we have the home and community-based services waivers, MA waivers, if an individual under, the age of 18 is eligible for that waiver, there is a self-directed option to access an assigned budget, which could then be used for a PCA or a paid caregiver, but you can also use it in the manner of paid parent of a minor in Minnesota. That was and is for a lot of families really the only option, because we can't work in our chosen field. But like Tony said, this is work. It's actually the hardest work I could have ever imagined. And I'm going to be doing it for the rest of my life. It would be great to save for retirement. My retirement is going to look a lot like my current day-to-day life, because I'm going to continue to care for my child. But these waivers can really help families access certain things that insurance does not cover, but that would be helpful. And also it would be helpful in keeping your minor child in the home and in the community, in the community, and living a life of choice. So I guess kind of the way I'll explain it is that I believe that these waivers, who are accessible, I think, to a lot more people than actually use them. I think that not only can they be helpful, but there's also a consumer directed option that can be really important in the lives of individuals with disabilities and their families to make decisions together.
Thank you. Well, I'm hoping that the audience gets their questions ready for Melissa, Tricia, and Tony. I'm going to ask one last question to each of our panelists, which is, what are some specific steps and actions that participants in this call can take to advocate for family caregivers and financial sustainability especially? So I'm going to go back to you, Tricia, to kick us off.
So I think the most important things when we look at these systems and services that provide programs and policies is that they need to be designed by those stakeholders, those consumers of those services, and the people who are impacted by those policies. So we really need to bring to the table the caregivers. They need to be front and center at the design, the implementation, and the evaluation of every single program and policy that's out there that's going to impact us. It's really exciting to see more and more systems bringing caregivers to the decision-making table versus saying, because what we've seen for a long time, and we still do, is, oh, yeah, we have a caregiver at the table, so please check that box. Or we invited a person with a disability, and I think they're on the call, so we'll check that box. But really, truly partnering with people with disabilities and their caregivers or their families, it's really a different experience when we can partner in doing this work. And so my biggest advice would be to push systems, push organizations to intentionally create that space at the table every time they come together, or even before they come together, challenge them to create that space for a full partner.
I think everybody on this panel would be in violent agreement of that. Melissa, I'm going to turn it to you.
You know, I'm, as I mentioned before, we're really starting to look at, our long-term care, end of life, life expectancy, all of those kinds of things right now. And one of the things I want to stress is that it's really crucial to know what resources are available to you and to get assistance with those benefits. So for example, as a veteran family, there are some survivor benefits that we qualify for. So do your homework, find out how you qualify, if you qualify, an approximation of the amount of benefit that might be received. I know we can't always guarantee, but to kind of plot out what is my income going to be if my loved one passes. What happens if he is in long-term care facility? How does that change our income? And then know how to access and apply for those benefits. What records are needed? Have those records on hand. We often hear from families after their loved one has passed that they don't know where or how to get military records to file for their benefits. And that's really an uphill battle when you're starting with nothing to try and find the documents you need to even apply for the benefits to see if you qualify. And then arrange your advance directives, your living will, your POA, any DNRs. Arrange those things early. There's no minimum age to be prepared. My daughter is married to a pilot, and so we are often talking about what kinds of things he needs to have in place, because if something happens to him, she's alone with a young child. And so we're trying to think, and it's bringing up conversations with all of my children who are just in their early 30s about what kinds of things they need to have in place. I was very fortunate in my role to work with a principal at my elementary school who was incredibly supportive of my caregiving needs. He was willing to arrange substitute teachers whenever I needed them, even if I called and said, hey, they're keeping us out of town for another day of testing. He would just step in and arrange things. He made sure that my work life was not a stressful component. When my husband needed more supervision because he was having trouble knowing what he was doing all day, he was forgetting where he was having a lot of falls, he allowed me to bring my husband into work and volunteer in the kindergarten classrooms because he needed more supervision and he wanted to make that comfortable for me. And I know that's not an option everywhere or in every position. However, if employers can consider ways to offer remote work options or flexible work hours, having online meetings and training opportunities, those kinds of things can make a huge, huge difference. And being understanding, even if there are barriers where you cannot provide a remote work opportunity, perhaps, being understanding of the caregiver's needs. Providing paid time off, using donated leave programs, those are always very helpful. That's what helped me fill out my FMLA leave before I resigned from my job. Encouraging them to use employee assistance programs that are available. And then as I know Tony mentioned, FMLA, expanding eligibility to include extended family members, increasing the amount of time off that's available, incentives to include employers that have 50 or fewer employees, things like that would be very, very helpful when you look at FMLA and how people are going to support this for the long term. Because often when we become a caregiver, it is not a quick 12-week fix and we go back to work and everything goes back to the way it was. So encouraging your members of Congress to explore these issues and identify long-term solutions that will help our caregiving community. Other things to consider are things like providing financial and legal planning through caregivers, through employees, the Department of Defense, the VA, decreasing health insurance premiums and revamping the criteria for healthcare eligibility, expanding VA caregiver support services, improving the life insurance option for veterans, and then developing and funding programs to provide long-term care options for the care recipient and the caregiver. I think an important piece of this conversation that we often miss, and this is maybe focused more on healthcare than finances, but we often forget that the caregiver has their own physical and mental health needs, and they may develop conditions where they require a caregiver or assistance, and who's going to take care of them and the veteran. I know in my situation, if something happens to me, it's not going to be the veteran, my care recipient, who's stepping up to take on all of the work here. We're often told to take care of ourselves so we can take care of our care recipient, put on your own oxygen mask first in an emergency. And what's overlooked, I think, is that we're human beings who ought to be able to take care of ourselves, have our financial security for our own quality of life. I have a dear friend, Shayna Purser, who's a fellow social worker, and her quote that I love is, "We deserve to be healthy too." And I think that's really an important component, whether it's financial health, physical, mental health, just because we are a human being, not because we're a caregiver who's serving someone else.
Well, today's caregiver is tomorrow's patient if we don't start to think about these services more effectively. Tony, I'm going to turn to you.
Sure, and I love this question because it provides the opportunity to talk a little bit about this roadmap that we have to support family caregivers, and it's called the National Strategy to Support Family Caregivers. So it represents the first time that a broad cross-section of the federal government has collaborated with the private sector on a response to the longstanding national need for a comprehensive system to support family caregivers. And the national strategy led by the Administration for Community Living, otherwise known as ACL, was developed jointly by the advisory councils created by the Raise Family Caregiving Act and Supporting Grandparents Raising Grandchildren Act, with extensive public input, including from family caregivers and those that they support. So this national strategy has nearly 350 federal actions that can be taken by the federal government to support family caregivers, and more than 150 actions that can be adopted at every other level of government and the private sector to help build a national infrastructure to support family caregivers, including improving financial security for them. So supported by the John A. Hartford Foundation, NAC, along with 11 other steering committee members, including RCI, who we're really proud to have as members, have created a campaign that brings together stakeholders across the caregiving continuum. So this is aging groups, patient advocacy groups, disability groups, and caregiving groups to help strengthen this first ever national strategy and support America's 53 million family caregivers. So there's plenty of opportunities to get involved with this Act on Raise campaign. You can go to actonraise.org/join-us, which I think is going to be dropped in the chat. And we have nearly 100 campaign partners and 175 individual advocates and family caregivers who receive updates as well as opportunities to engage in advocacy. And we try to make this as easy as possible because we understand that family caregivers have a lot to balance as is. So creating templates to sign on to letters, opportunities to reach out to your congressional representatives. I
think Tony has frozen.
And the last piece I just wanted to emphasize really, really quickly is that you should talk to your representatives when you have the opportunity to, right? Pick up the phone, even if it's 30 seconds, and let your state legislator, let your council member, let your Congress member know why you support certain policies. They keep track of that and want to hear your voice.
Thank you, Tony, and thank you all for responding to that question. I'd say many caregivers are asked, let me know what I can do to help when someone hears that they're in a caregiver journey. And I often think the response could be, go do this advocacy for me. I don't have the capacity, but you could be out there making those phone calls. And that feels relatively straightforward. I think some of the tools that were brought up today could be helpful for that as we think about people. So I encourage people to put their questions in the Q&A function here on Zoom so that we can respond to those going forward. And also moderator privilege, I'm going to say what we think is a great opportunity for advocacy going forward is to advocate for an Office of Caregiver Health in the federal government, because right now there is no single stop that supports all the caregiver experiences. We know our colleagues at ACL are working really hard for the communities they serve, but there are many other caregiver experiences. And as you heard on this call, so much of the caregiver journey is about complicated regulations, understanding forms and coordinating. It would be amazing if every new regulation had to go through a caregiver lens before it came out the door for payment and process. So we'd love to see that. So I think one question I would ask to get us started is, if there was something that you kind of wish you knew in each of your caregiver experiences when it came to finances, you know, one thing that if you knew it, it would have made all the other things relatively easier or maybe just less painful, what would that be? Because I think you'll have some caregivers on this call who are maybe earlier in their journey. So what can they be on the lookout for? I know Melissa shared some of these tips in the VA experience, but I'm sure there might be a few others you could share, Melissa, to start us off.
Yeah, you know, when you say that, what hits me is the knowledge that I was going to become unemployed for a period of 5 years. And, you know, at that time we had teenage children. My husband lost his job at the fire department, as I said, and there's a gap between your military pay ending and your VA services starting. Oftentimes, I know we hear that a lot from families, and you know, that can be anywhere from a few weeks to a few months. And so had I known that we were going to need a safety net to get us through, especially that first year, but even 5 years down the road before I was able to start doing some part-time work from home, that we were going to need to have those things, because things still happen. You still need to replace your refrigerator and you need new tires, and you know, my kids are trying to go to college. So there were lots of things I would have been better prepared if I'd known I was going to need to bankroll some money up front, instead of thinking, we're still young, we've got plenty of time to do that, when this happened out of nowhere.
So life didn't stop when caregiving started, is what I hear from that. Trisha, I'll go to you.
Thank you. I think there's so much I wish I would have known, and so much that I'm still learning. And the large majority of what I have learned has come from other caregivers, other parents of children with a special need. They know the ins and outs, they know how it works. And I wish that I would have known how to connect and trust those individuals a little more with reliable information than the larger system representatives. You know, in talking to an individual, a financial worker, about my son's medical assistance, that worker had no idea that he actually should be eligible for MA based on his disability and not our financial situation. And because the worker didn't know that, and because I thought, well, if I just tell them, they'll check that box and it'll all work out. We missed out on a lot of support and services that would have been helpful early on. And again, I just say, like, if it's that hard for me to figure it out, it's hard for everybody. And it doesn't need to be that way. So I guess I wish I would have talked more to other parents who'd been down a similar path, who could maybe guide me and say, yeah, that worker probably doesn't know what they're talking about. Maybe go here or look here for reliable information.
Yeah, I mean, I think the power of peers is something that Melissa and the team at the MVCN, the Military Veteran Caregiver Network, know all too well. So I think that's important to enable more of those peer opportunities for every caregiver sub-community and community that exists. Tony, I'm going to turn to you.
Yeah, I definitely think, just to reiterate what Trisha and Melissa was saying, you know, leaning on community and being able to have these conversations. You know, I talk, you know, when I'm trying to deal with health insurance claims and things like that, and navigating those spaces, it's been really helpful to be able to talk to peers. And you know, I was talking to my mom the other day. She was saying, you know, it's so much, you know, it's easier, it's nice to be able to talk to other people who have navigated these things in order to help me navigate them. I think the second piece of this too is, you know, I think in terms of like aging, thinking you can't always plan ahead. But I'm noticing, you know, with with my generation, more and more people are thinking about financial security and retirement and like what's going to happen to their loved ones, and having those conversations early on, and I think getting young people who, you never know what's going to happen in the future, to think about these things early on is a place to start.
Well, thank you all. Thank you to our panelists for sharing their insights. Thank you to our participants who listened along, and I hope you all found value with today's conversation. And thank you to the team at Health Leads for bringing us all together to have this conversation. I'm going to turn us over to our organizers to close us out.
Thank you so much, Jennifer. Incredible moderation. And I want to again thank all of our panelists, Melissa, Tony, and Trisha. So I would like to thank everyone for attending. We have a list of resources from today's conversation, and that can be accessed by downloading the PowerPoint presentation that will be located under the handouts at the bottom of the session page. Please feel free to give us feedback by rating this session. You can do so by clicking the Rate Session button, which can be found directly underneath this session title in your interface. We really hope you enjoyed what folks shared today, and look forward to your feedback. And the closing remarks will start in just a few minutes. Thank you.